So our next presenter is Dr. Patty Mitre. It's wonderful to have her present to us again. She's going to be presenting on a really exciting collaboration we were fortunate to enjoy with a pharmaceutical company called QPEX.
Oh, well, thank you. I will be talking about a phase 1 study of safety, tolerability, and pharmacokinetics of oral ceftibiprine in healthy adult subjects. Well, we know that the global rising bacteria that are resistant to antibiotics presents a significant challenge in treating infections. And particularly concerning is that there are very few oral antibiotics that are available to treat some resistant bacteria, resulting in patients requiring hospital admission just for intravenous antibiotics to treat their infections. Some pharmaceutical companies are trying to respond to this crisis by developing new antibiotics. QPEX Biopharma is developing a combination antibiotic of ceftibiprine and cefoperazone. Ceftibiprine is a cephalosporin antibiotic currently approved in the US at doses up to 400 milligrams once daily. However, higher doses of ceftibiprine may maximize its efficacy against severe infections caused by gram-negative bacteria. Our collaboration with QPEX involved a phase 1 clinical trial exploring doses of ceftibiprine exceeding the licensed limit of 400 milligrams once daily. This study aimed to describe the PK, safety, and tolerability of single and multiple oral doses of ceftibiprine administered to healthy adult subjects at doses higher than the approved. This was a double-blind, randomized placebo-control and sequential ascending single and multiple dose study of oral ceftibiprine, where 3 doses were studied: 400, 600, and 800 milligrams. The 400 and 600 dosing groups consisted of 10 subjects, 8 active and 2 placebo, while the 800 milligram group consisted of 20 subjects, 16 active and 4 placebo. Within each group, subjects received a single oral dose on days 1 and 4. And then, after the first dose on day 4, 12 hourly doses were administered for 7 days. Blood samples were drawn for over a 24-hour period on days 1 and 10, while urine was collected up to 48 hours post-dose. And on day 4, both blood and urine samples were collected over a 12-hour period. Now, the plasma and urine samples were assigned for the administered form, cis-ceftibiprine, and its less active metabolite, trans-ceftibiprine, using validated chromatographic methods. And the PK parameters were calculated by non-compartmental analysis using Phoenix with nonlinear. The plasma PK parameters included the maximum observed concentration, Cmax, time of the maximum observed concentration, Tmax, the area under the curve from 0 to 20 to time t, and from 0 to extrapolated to infinity, the terminal half-life, the apparent volume of distribution, and the apparent clearance. While the urine PK parameters included the amount of drug excreted in urine, the fraction of the administered dose excreted in the urine, and the renal clearance. Dose proportionality for increasing doses and plasma PK parameters was examined graphically using the area under the curve values on days 1, 4, and 10 by linear regression, and statistically using analysis of variance of the dose normalized exposure parameters. And accumulation going from a single dose to steady state with repeated administration was calculated as the ratio of the area under the curve from day 10 divided by that on day 4. To assess safety and tolerability, adverse event monitoring was conducted daily during the trial. As we don't have enough time to go through the full results, these have been published in Antimicrobial Agents and Chemotherapy, and I will proceed to summarize the most important findings. So the plasma PK parameters were obtained for cis and trans ceftibiprine, while urine pharmacokinetic parameters were obtained for cis, trans, and total ceftibiprine. Following single and multiple doses, both cis and trans ceftibiprine exhibited a dose-dependent increase in exposure parameters. The mean elimination half-life of cis ceftibiprine remained consistent across the studied dose range, with values varying from 2.7 to 3.1 hours. And in general, renal excretion is a significant pathway of ceftibiprine elimination. regarding dose proportionality, well, the exposure of cis and trans-ceftibirin increased with increasing doses, and the linear regression analysis showed that the increases were dose proportional. And the ANOVA confirmed this finding since no statistical differences were found for the dose-normalized exposure parameters on days 1, 4, and 10. Regarding accumulation, the ratio values indicate cis and trans-ceftibirin accumulation over 7 days of multiple dosing. There were no serious adverse events, deaths, or other significant adverse events reported in the study. Headache and nausea were within the most frequently reported adverse events in both the SAD and MAD cohorts. However, these were mild or moderate in severity and resolved while subjects were still receiving the study drug. Only one subject receiving ceftibirin at the 800 milligrams dose discontinued from the study due to persistent nausea. So in conclusion, the plasma and urine PK of cis-ceftibirin and its trans metabolite were investigated in healthy adult subjects following single and multiple oral doses higher than the 400 milligrams once daily approved. Renal clearance was the significant pathway of the total clearance of ceftibirin, which was mainly recovered as cis-ceftibirin. Dose proportionality was seen following single and multiple doses of 400, 600, and 800 milligrams. There is little drug accumulation of cis and trans-ceftibirin during multiple dosing. And overall, the safety and PK data from this study supports the ongoing development of ceftibirin for single and multiple doses up to and including 800 milligrams twice daily. And I would like to finish this presentation just highlighting that the antimicrobial optimization team at the UKCCR is the first and only group in Australia accredited with NATA to ISO 17025 for non-compartmental analysis. Thank you.
That's wonderful, Patty, and I think it's really special that all of your work with ceftibirin is actually going to make its way into the product information for that drug and stand for all time. So congratulations on that work.